Hi Kelly, how are you?
Good, how are you?
I'm very well.
I've just got a query about, I'm a teacher obviously, someone's just said. I had an incident once where a child fell over in our playground. We've actually got no grass. So their second tooth actually was knocked out.
Yes.
When they landed on the concrete. We just put it on ice and they got rushed away to the dental people, but someone actually told me that you should try and push it back in.
That's exactly the right advice.
Oh, yeah. Okay.
A permanent tooth or a second tooth,
yeah.
If it's knocked out, it needs to be put straight back in, because the prognosis for that tooth is at its best if the tooth goes straight back into the socket. And, even within the first 15 minutes. Once you go past that, you can still put it back in by all means, but the prognosis is not as good. And I just think that that's the very best advice. Now, a poor second, I guess, I'd have to say, would be to put it in milk and find a dentist. I mean, you still, once you've put it back in, you still need to find a dentist. But it's much better in the socket where it's being nourished, whereas when you put it in milk and putting it on ice, I know when someone loses a finger or whatever, you put it in ice and they take them to the hospital. It's not so good for teeth because they're affected by the water. It's much better to put it into milk and then find a dentist. And it's quite difficult on a Sunday afternoon to find a dentist. So to me, you're a lot better off to get it back into the socket. And really, I mean, it's pretty easy. It goes pointy end first. And even if you've got it round the wrong way, it doesn't matter. It's better to get it back into the socket where it's going to be nourished. And the majority of people are going to get it the right way round. I mean, it just looks right. You've got one on either side usually to check it against. So, and the child's usually in a little bit of a shock, but, with a very gentle approach, you can probably get that back in there.
Okay, I just find it's so hard to find information on, accidents with the mouth and the teeth. We're always trained with first aid, but in terms of, an accident with the teeth.
If you'd like to go to the Australian Dental Association website, which is www.ada.org.au, we're having a very big promotion, as we do every April, with mouthguard usage. But also there's a kit there which gives you all the information and advice and posters and all sorts of things that you need for your sporting body or your school.
That's because I'm actually the sport coordinator at the school. So
if you go there, you'll be able to order a kit from them and they'll send that out to you free of charge, and that will give you all the information you need to do training amongst your staff and also to amongst parents, so that they'll all know what to do if a child knocks out a tooth or breaks a tooth or any of those sorts of things. And also about wearing mouth guards, because that's one of the topics that we've got on our list tonight to talk about, is the wearing of mouth guards. And it can be difficult to find the right sort of mouth guard, and even at school with school sports, I can imagine it must be pretty difficult to...
it is, and with the concrete as well, it makes it a lot harder too.
But getting kids to actually wear the mouth guards if they're not very well fitting is a problem. Yeah, they just don't want to wear them.
No, absolutely they don't. I mean, footy they do, but that's about it.
Well, and says that they have a rule for a lot of sports that says no mouth guard, no play, and I think that's a very good way to go. Once the damage is done, it's endless throughout adulthood. Yeah,
absolutely. Yeah. And is there fact sheets and things on the website that I could possibly print off to put in newsletters and things like that?
Yes,
great.
They have all the mouthguard information there with fact sheets that tells you what to do when a tooth is knocked out.
Okay, wonderful. Thank you so much for your help.
That's all right, Kelly. Thanks for the call.
Bye.
Bye.
Bye.